the President of the United States.
In the most important speech so far in his presidency, Mr. Obama sought to regain the political momentum on health care in front of a joint session of Congress and a national television audience.
I understand how difficult this health care debate has been. I know that many in this country are deeply skeptical that government is looking out for them. I understand that the politically safe move would be to kick the can further down the road, to defer reform one more year, or one more election, or one more term. But that is not what this moment calls for. That's not what we came here to do. We did not come to fear the future. We came here to shape it. I still believe we can act, even when it's hard.
Initial reviews of the president's attempt to revive the reform effort have been positive. Political analyst Norman Ornstein of the American Enterprise Institute.
He allayed the concerns of some voters in the middle who have been uneasy about whether this would be good or bad for them. The second thing the president's speech did was to energize his own Democrats, who have been divided on this issue and uncertain about where to go.
The president and his Democratic supporters in Congress want to offer health insurance to tens of millions of Americans who currently don't have it. They also want to rein in the skyrocketing cost of health care. But the reform effort faltered during August, when lawmakers faced intense anger and criticism at sometimes chaotic town hall meetings around the country. Conservative opponents targeted the health care reform effort during a recent march on Washington. Republicans opposed the president's effort as too costly and too much government involvement in the economy. And they say the president's recent speech did little to alter the political atmosphere. House Republican leader John Boehner.
Americans are frustrated, they're angry, and most importantly, they're scared to death. They're scared to death that the country that they grew up in is not going to be the country that their kids and grandkids grew up in.
Despite the opposition, reform supporters continue to mobilize. Gordon Duvall came to lobby Congress from Colorado.
This is our government. It's a government of the people, for the people, by the people, and the by the people piece needs to get back into it because this is ours. We can't say government is corrupt. We're government.
The political stakes in the health care debate are enormous, says Norman Ornstein.
Obama defined health reform as his #1 domestic priority after economic recovery. A failure to act on health reform sends the signal that this majority that we brought in to act can't do it. And the victims are going to be his own Democrats in Congress.
Ornstein still believes some version of reform is likely by the end of the year.
It will be not a full health care plan. It will be more like a third of what the supporters of dramatic change would like. But it will make a very real difference in the lives of a lot of people.
Failure to act, he says, could lead to big Democratic losses in next year's midterm congressional elections. Jim Malone, VOA News, Washington.